Hi, I'm Larry Mike Renda, and welcome to this edition of Profiles. With us today is a renowned doctor. He's a cardiologist, MD. He is Dr. David Kavesteen. We've had him on the program before. And with everything going on, the health news, and all the talk about Ebola, infectious diseases coming around, flu season, we figured we'd have him on and answer some questions that you had from last time when people had seen him on the show. Dave, great to have you on the program again. So many things going on in medicine. But before we start, do you want to tell everybody about your credentials? I mean, your whole background in medicine?
Sure. Thank you for having me here. Obviously, it's always a pleasure to come to you and the audience and answer any questions and just try to help and educate our community. I'm an all New Yorker. I went to SUNY Stony Brook, not that far away from here where we are. I did my undergrad, specialized in biochemistry. I got my Bachelor of Science in there with distinction in research, and then went to medical school downstate in Brooklyn. And later I went to NYU to do my internship, and I got internal medicine residency at NYU and finished it, and later pursued my dream of being a cardiologist. And I went back to Brooklyn to Maimonides Medical Center, and I got my fellowship completed and became a board certified cardiologist in 2005.
And one of the things too, which is impressive, is like you've worked in all the hospitals out here, the city hospitals. You're all connected with all the like major hospitals here in New York State.
You know, being a New Yorker and having a privilege of working in all the boroughs and Nassau and Long Island and Suffolk County, I was, I'm part of admitting physicians in Good Samaritan Hospital, Catholic Health System, North Shore LIJ, Southside Hospital, Winthrop Hospital, and also Mount Sinai Hospital. And throughout my training, I have rotated through multiple different institutions, such as NYU Bellevue Hospital. As you know, that's a hospital that designated to be Ebola center for that infected person. Ironically, I was running that floor in 2001. At that time, I don't know if you remember or not, we had epidemic of a multi-drug resistance tuberculosis and also multi-drug resistance HIV/AIDS. That was during the whole outbreak. So there's a specific floor design in Bellevue to deal with this type of infection disease that is very contagious and has to be isolated and treated.
So you basically have baptism by fire, just coming out of the college and internship, and then being thrust right into what do they call it, emergency medicine now?
Emergency medicine. Infection disease obviously is a department is taking care of those infection patients that get admitted to the isolation. It's very interesting because these floors are equipped with a facility that they have a negative pressure, meaning like the room has a negative pressure in it. So if anyone walks into the room, instead of the viruses coming to the hallway or coming to the other rooms and contaminate the rest of the staff or rest of the facility, is a negative pressure, so actually viruses get sucked in. They also have a UV lights in the rooms, they have air filters, they have double doors, and there's always a security guard outside the door, so the person who's infected is not allowed to leave the room even they feel well enough to walk out and ambulate. So it's very strict, and it's one of the best departments and facilities we have.
And you were just saying about Ebola, and now we have this whole thing going on with the Ebola virus. People are very terrified and scared. People have to really realize that this is not like the flu. It's not an airborne virus, and it's not I think they call it the waterborne virus. It has to be, it's spread like by direct contact. Maybe you could calm down the audience a little bit and tell them a little bit about it.
Of course. We have the infection diseases happen through two processes. One process is a virus, and the other one is bacteria. Bacteria is a living organism that we can easily kill with antibiotics, with penicillins, with multiple different brands, and different. Basically, these are chemicals. And bacteria is not. They can't live outside the living organism. So if I leave, for example, Staph aureus bacteria on a dry surface, after a while, bacteria needs nutrition, so they die and they go away. Unless there's a specific type, they go dormant and they stay there for a while. But majority of the bacteria, they need a right temperature, a right body and nutrition to live and multiply. Viruses, on the other hand, they're not a living organism. They are they can live and they can stay in a dry surface for some time. Now, as far as Ebola goes, the research basically shows they can they can be on the surface for about 6 hours. So they have to be cleaned off. They have to be disinfected. All the towels, anything that is contact with the patients that could have that virus on it, they burn it and they destroy it because you don't want to take a chance of these viruses stay there for a long time. Can the viruses stay for a longer period than 6 hours? There's a possibility. We don't know as well. Ebola virus has been a very dangerous virus that we know of. And we always tried, I think the most recent virus that we had to deal with was HIV. And if you remember the whole panic and the whole cascade that happened. But with pursuing science and doing more experiments and advances, we were able to come up with antiviral medication to treat HIV and have the HIV to not be a fatal disease that we thought originally it was. Same process is happening to Ebola. However, Ebola is a much more dangerous virus. It can be in your body for about 21 days before you show the symptoms. And once you show the symptoms, it's a little too late because if they don't treat you well, the mortality is very high. However, if you look at the patients that we already had in the United States, by the way, I want to say that United States, we have the best medical care and treatment in the world. And the testimony to it is the fact that we had these Ebola patients. And if you look at it, when this disease has about more than 80% mortality in other countries, right? A lot of people died in Africa. However, the number of the patients that we got in the United States by traveling or contacting or whatever means it was, a lot of them they lived. There was only one fatality from Ebola, and there have been about 5 or 6 cases of of these infections coming up in the United States. So we have a very good treatment, we have a very good hospital, we have a great doctors, and with these 3 combinations, we were able to beat this virus. And I think now that we're doing more studies and more research about how to deal with Ebola, we're going to come up with vaccines, we're going to come up with medications, we're going to come up with a lot of different treatment so Ebola doesn't become as dangerous as everyone fears of, and we can control it.
And you had mentioned before the program that there's these new tests that are coming out to find these infectious diseases that medical science has really stepped up, and they can really find out these diseases way before they've even really started showing symptoms and stuff like that. Can you tell us a little bit about that?
So the way we right now we know, or the way that we were treating Ebola, especially in Africa, was the person comes up with specific symptoms. Meaning what? Meaning that the patient has contracted a virus. The virus has stayed in the body, multiplied for about 20 days, 21 days, and then the symptoms comes up, and the symptoms are fever, chills, bleeding into the eyes, bleeding, nausea and vomiting, bloody diarrhea, coughing and blood. And when those symptoms comes in, then you would say, oh my God, you have Ebola, and obviously shortly after, patient dies. Now we can detect it a lot easier. We can actually detect the antibodies that the body produce before even the symptoms comes in. I'm sure you heard that CDC, we were able to send this test, they send the Ebola test out, and we can do it in New York State. We can send it to CDC for confirmations, and any other states, and we can actually detect the amount of the virus and the antibody to the virus that the body produces and diagnose the disease before it's too late. So we can give the treatments. The treatments are antiviral medications, plasma from other patients that they actually beat the disease and they have antibodies to it, which is a very novel thing. If you think about it, for example, if you have Ebola and you survive, your body produces these antibodies that treats the virus and kills the virus. Now these antibodies stays in your body because you're not going to get Ebola anymore. You are immune to it, correct? So if I get that part of your antibodies from your plasma and give it to me if I'm getting infected, your antibody can help me to get cured. And this is the same process and the same concept that we did for the other doctors that they came back from Africa with Ebola. And it's a very effective treatment and works very well.